My name is Dr. Niall Vallely. I'm the lead cosmetic dentist at 3Dental and co-owner, and I just want to talk a little bit about porcelain veneers today. So a porcelain veneer is just a really thin little sheet of porcelain which is shaped like the front of a tooth, highly polished, and usually a nice bright color of porcelain. They really are miniature works of art. They work by simply being bonded in a permanent way to the front of the tooth. So veneers are a really durable, long-lasting cosmetic treatment. I would say that my veneers should last 15 to 20 years. Obviously they require really good maintenance, both at home with your oral hygiene routine and also coming in for regular checkups. Absolutely, veneers, as I say, last 15 to 20 years. They can be used for purely cosmetic purposes, but also to cover over teeth that have had old fillings or that are chipped and broken. They're very effective at making an old, worn down tooth look like a beautiful new tooth. To get the longest life out of your veneers, it really is just about looking after them as well as possible. And there's no special tricks. It is about really good regular brushing. It's about flossing. It's about coming in to have your teeth cleaned with your hygienist every 6 months and have them checked up by your dentist. Veneers are generally made out of porcelain, which is a very strong, durable material and also really impervious to staining from foodstuffs. So it's hard like enamel, so it can stain, but just with brushing and visits to the hygienist, that'll keep them looking great. Veneers are a permanent treatment. They should last a long time, and they are a technically difficult treatment to do. The cosmetic dentists that we have at 3Dental are highly trained and have a lot of experience with doing porcelain veneers. It's really important when veneers are being done, they cause minimum interruption to the tooth structure. So either no preparation, or probably best is just a very minimal amount of preparation to the tooth structure. That requires a skilled dentist, and ideally a dentist who does a lot of porcelain veneer work. Well, there is no specialist qualification for a cosmetic dentist in Ireland. You would want your cosmetic dentist to have done postgraduate training on porcelain veneers and a lot of experience in doing veneers or any cosmetic treatment. Ultimately it will be creating a new smile for you, and that is going to be really important. So you would want to entrust that with somebody that does a lot of this work, has a lot of experience with this work, and somebody that you can follow up the treatment with also. I would be wary about recommending going abroad, particularly to Turkey, for your veneers. What I've seen is a lot of treatments where the patient's teeth have been really heavily cut down. There's very little tooth structure left there, which gives us a really high chance of requiring root canal treatments, or indeed, because there's so little tooth structure left there, in time, high risk of the whole tooth fracturing. On top of this, oftentimes the treatments are rushed in the space of a few days or even a week, which isn't a long time for the lab work to be made correctly, for the preparations to be done correctly as well, and rushed, over-prepared work like this is not going to give you the best long-term outcomes. As a restorative dentist, I do cringe when I see these teeth that are so heavily prepared. I know that they are going to cause trouble in the long term. I think it's cutting corners, doing very heavy preparation of the teeth, removing all of the enamel. It makes the job for the technician a little bit easier. It requires a less skilled, less talented technician to actually to make the crowns or the veneers, but ultimately this is your teeth. You've only have one set, and the tooth structure is very precious. So you would want to have a clinician that you could really trust, that will look after your teeth like he would look after his own. Clip-on veneers seem to be a little bit of a fad going back. They aren't a serious long-term treatment. They're not something that you're going to be able to use or eat with, and oftentimes, because they are bulky and sitting over your own teeth, they look quite ridiculous. So they're not really a strong alternative to porcelain veneers. An alternative to porcelain veneers would be composite veneers, which are placed directly onto the tooth structure. Composite bonding is another way to describe this, but I suppose the composite veneer would be covering the entirety of the surface of the tooth. They can be very effective at getting, really good cosmetic results. They are less expensive treatment than porcelain veneers, but they aren't going to get the longevity of porcelain veneers. Problems with veneers can occur. They can chip or fracture, or they can even debond. These are quite rare, as porcelain veneers are a really predictable treatment. Porcelain veneers can be repaired in certain circumstances. They certainly can be rebonded if they do debond, or worst case scenario, the porcelain veneer can be remade. Fortunately, this does not happen too frequently. Having your cosmetic or restorative dentist or your clinic close by, somewhere where you can visit the same day, I think is really important. If you have had the work done overseas, you run into a difficulty where you're looking to get a flight and maybe you can't have things repaired for a few days or a few weeks, and you're also incurring expensive travel costs. If you do have a problem with your veneers, we can get you in straight away to get them repaired or fixed. Life with veneers, ultimately they just are another part of your teeth. After a small period of adaptation, they really should feel like your own teeth. Ultimately, the cosmetic outcome of the porcelain veneer, how it looks, how your smile looks, will be largely in the patient's hand. The colour of them, how natural they are. If you want veneers that are very subtle, that are just the best version of your own natural teeth, that can be done. If you want to make a statement, have quite white teeth and that real full magazine smile, that's possible as well. It's important to put veneers on teeth that are healthy and gums that are healthy also. It's a bad idea to put veneers on unhealthy teeth and where there's disease processes there. Veneers can be put on worn teeth and broken down teeth, but they should not be put on teeth where there's gum disease or tooth decay. That needs to be treated first. So veneers should last 15 to 20 years, and the main reason to replace a full set of veneers would be that they start getting a little bit tired looking, maybe the gums have receded a little bit around them, and just to revitalize the smile, but this should be lasting 15 to 20 years. Veneers really are an irreversible treatment, and if you have porcelain veneers, you're going to be keeping porcelain veneers throughout your life. Composite veneers can be reversed. Composite bonding can be removed completely in most cases to leave the natural teeth there. So it's important to keep the teeth clean and brush them to remove bacteria from around the tooth, but certainly bacteria can't get between a tooth and a veneer when they're well bonded and sealed in. We'd love to discuss your cosmetic dentistry needs at 3Dental. You can come in for a free consultation. We can answer any of your questions, do smile design work, and get you the smile that you really want. You can book on for a free consultation on 3dental.ie through our messaging link.